So first I would verify physician's orders, make sure that the patient has no allergies, especially to any medications. And then I would check the MAR to make sure I have the right patient, right dose, right route, right medicine, and the right time. And then I'm going to check all of my supplies, make sure that the packaging is still intact and they're still in date, make sure my patch is still in date, and make sure my medicine is in date, as well as the top still being on, the seal hasn't broke on the vial. I'm going to gather all of my supplies, and I could either get all of this ready at the med station, or I could take it to the room and get it all ready there and then administer it. So I'm going to gather my supplies and go to my room. I would introduce myself. Hello, my name is Cassie. I'm going to be your student nurse today. The doctor's ordered some medicines to give you, so I'm going to get these ready and administer them to you. I would make sure that I have the right patient. So I would check the armband, verify name, date of birth, allergies, make sure I wash my hands, make sure the bed is in the locked position, at working height, and the side rails are in the appropriate spot. Then I would put on my gloves, and then the first thing I'm going to do is draw up my Toradol. So I have a 23 gauge needle. For IM injections, you can use anywhere from an 18 to a 23, so I have a 23. The order for the Toradol was 30 milligrams, and the Toradol is 30 milligrams per 1 ml, and the order is 30 milligrams, so I would draw up 1 ml. So I'm going to open my package. And then I'm going to pop my seal. And I do have gloves on for this. Going to open my alcohol swab and clean the top. Discard. Then I'm going to draw up 1 ml, which is the order. Now I am going to place this, sit it down on my surface. And before I started, I would make sure that I had a clean surface in the room. So make sure that the bedside table, if I was using that, was cleaned properly. Lay a paper towel down just to make sure. So now I'm going to inject that air into the vial and then invert. And now I have my 1 ml. Yep. So for this certain needle, I have to put the cap back on, but I would do it with one hand and then reclip it. I'm going to make sure all of my bubbles are out. And this one has a big bubble right here. Okay. All of my bubbles are out, and I have 1 ml. So if I was doing this at the med station, I would label it, date, time, and initial it, and actually write the medication name on the package, just so once I grabbed all of my stuff, I would know what's in what package. because I wouldn't want to mix an IM injection up with a sub-Q. So I'm going to set that aside. Now I am going to label my patch. Open it. Take it out of the patch. Make sure you have gloves on. And then I would date, time, and initial it. So and then the time. I'll just make up a time. So then I would place that back in the package and make sure I have a Tegaderm too for that. And then for the insulin, the order is 12 units every morning. So I'm also going to open the package, draw up my 15 units. And with insulin, you always want to make sure it's verified. So I would have to draw it up and be sure that somebody verified this insulin with me before I gave it. So I would get another alcohol pad and my insulin vial, and then clean the top. And then insert the air, invert, and pull back the 15 units. Again, the cap has to go back on until I'm ready to inject. So also with this, I would date, time, and initial it and put the medication name on the package just so I would know. So now I have all of my drugs ready to administer. So the first thing I'm going to do is put on the patch. So I would take I'm going to pretend this is my old patch. Take the old patch off, fold it in half, and discard it. So narcotic patches, you would flush. Any other patches you could fold in half and throw away in the trash, the regular trash. And then I would clean the site with soap and water, then pat dry. Make sure to put the new patch in a different spot. And now I'm going to put the new patch on. Still have gloves on. And the new patch I'm going to put on the right upper chest, since the last one was on the left upper chest. So I'm going to put the old patch there. I meant the new patch there, excuse me. Throw away my paper. And then I'm going to place a Tegaderm over the top. And make sure it is sealed down completely. Try to get it as smooth as possible. So there's my patch. Now, I also forgot to mention I would have to clean the new site as well. So clean it with soap and water, pat dry before I put the new patch on. Now I'm going to give the insulin. I'll give the insulin in the right lower abdominal quadrant, since the last one was given in the left upper arm. So have to keep in mind, being in the abdomen, you have to be at least 2 inches away from the umbilicus. So I've got my insulin, and then I'm going to clean my site, and then take off the cap, make sure it's a meaty part, and then I would inject at a 90 or 45-degree angle, depending on how much subcutaneous tissue that the patient has. Inject and withdraw. And now for this, now that I'm done with it, I can put my safety on my needle. So the last thing is my Toradol, and I'm going to give that in the, let's see, I'm going to give the Toradol in the deltoid. I have to keep in mind that you can only give up to 1 ml in the deltoid. So this is safe to administer in the deltoid. So I've cleaned my site. I'm going to use the Z-Track method. So I would pull back and move the top layer of skin over, clean my site. Oh, my needle came off. There we go. Clean my site, Z-Track method. Then I'm going to inject at a 90-degree angle into the muscle. I'm going to hold, aspirate. If no blood, then I'm okay to inject the medication. Now I can let go, remove the needle, and apply a gauze if I needed to. And then I have put the safety on my needle. And then I would apply the gauze if needed. Then I would get rid of all of my supplies, discard, make sure my needles go in a sharps box, get rid of all of my supplies, wash my hands, make sure the patient's bed is in the lowest lot position, call light is in reach, all belongings are in reach, make sure side rails are appropriate, and then I would document and monitor for adverse reactions. And that is it.